Hi, I'd like this prescription filled.
Yes, of course. Let's see here. Yep, we have it. Just so you know, it's not covered by your insurance.
What?
You'll have to pay for it out of pocket.
That can't be right.
Sorry, it is.
Could you check again?
Okay. Yep. Still not covered.
You're being outrageous!
Me?
Yes! You're denying my husband's medication!
You can have it if you pay for it.
This is what's killing my husband, you know.
Not having his...
Your poor customer service.
That's not medically possible.
You're a murderer! You're murdering my husband!
I'm definitely not.
You are withholding life-saving medication!
It's sildenafil.
So you admit it!
It's for erectile dysfunction.
Fine. If you won't give it to me, I'll go somewhere else that will.
Be my guest.
While I'm here, you may as well at least help me with something.
What is it?
Can you double what's prescribed?
Double?
Double.
Okay, sir, your CT scans came back, and I can officially report that you are not constipated.
Oh, good. What is it then?
You just have a very large pill bottle stuck up your rectum. Like, really large.
I got that at Costco. They only sell in bulk.
Wait. So you knew this was the problem?
Oh, yes. That's why I tell you I'm constipated.
I don't think you know what constipated means.
Sure I do. Constipated means you got something stuck up your butt. That's not what...
Whatever. Okay, when did this happen?
Yesterday. I stick it up there and then it's stuck. I even asked my son to come and see if he could do the trick, but no luck. So now I... constipated.
Okay, for future reference, if you plan on sticking anything up there, make sure it's designed to go up there. And nothing from Costco.
Ah, I understand. Can I ask you a favor?
Sure, what is it?
Can you give me that bottle back after you get it out? I need the medication.
What's the medication?
Laxatives.
You gotta be kidding me. Has anybody heard from the resident on call?
Nope, nada.
Not I.
Hello?
Hello, is this the resident on call?
Yes?
I put 2 calls out to you already.
I'm sorry.
We have a patient here with blood pressure of 170/89.
Oh no.
Yeah, earlier it was in the 150s.
Oh no.
Is everything okay?
Yes, everything's fine. Does the patient have...
No headache, chest pain, dizziness, confusion. Patient is asymptomatic.
Let's get them on metoprolol with a stat dose now.
Okay. How much? Doctor?
5 milligrams. Let's start with 5 milligrams now.
Okay, look. The lowest dose of metoprolol we usually give is 12.5 milligrams.
God, so stupid.
Is this your first shift?
Yeah, it's my first solo shift.
Oh, okay. I see. All right, look, I'm not a doctor, but if I were, I'd consider metoprolol, 12.5 milligrams, twice a day, first dose now.
Okay, sounds good.
What does?
Metoprolol, 12.5 milligrams, twice a day, first dose now.
Is that in order?
Yes.
Great. Thank you, doctor. Do you need me to tell you how to enter it?
Yes, please.
Okay, first thing, turn on your computer.
Okay, sir, I see you're here worried about an STI. Yes, I caught my girlfriend cheating on me.
Are you having any symptoms?
How could she do this to me?
Sir, are you having any symptoms?
No, but I should get checked just in case, right?
Yes, of course. The doctor ordered a urethral swab.
What's that?
We insert a swab into your urethra to collect a sample.
Oh,
Yeah, no, right, of course. You understand what a urethra is?
hey man, you sound just like my girlfriend, always calling me an idiot. Of course I know what Aretha is.
Oh, no, not Aretha like Aretha Franklin. Urethra.
Are you calling me stupid?
No, not at all. I think you got it. Go ahead and pull your pants down and your underwear and we'll get started, okay?
Oh, hell no! You're not sticking that in there, man! You're crazy!
Sir, you left your pants! You could have at least given me some respect.
R-E-S-P-C-T, find out what it means to me.
I'm coming!
I'm coming.
I'm coming to you live for a comedy show.
Let's all come together to commiserate and talk some shit about those fucked up hospital conditions you work in. EMS, we're talking to you too.
Healthcare workers show up every day having to work for a company with the resources of a 4th world country.
And still, they do it with honor, with grace.
And with a resting bitch face.
But They get the job done.
And they deserve more than that measly crumb of a salary you dare to call a fair wage. These conditions are so bad, people would rather quit healthcare and start an OnlyFans.
Because if you're gonna get fucked, you might as well get paid correctly for it.
More cities to be added soon. Ticket link in bio.
See you soon, motherfuckers. And in the last room, we have Mr. Smith. 25-year-old male, came in last night for DKA.
How high was his blood sugar?
1,000.
Oh my god. Did you do the DKA protocol?
More like DK Slay protocol.
What was his latest blood sugar?
172.
That's great.
Yes! And now we're checking it every 2 hours.
Standing order?
Of course, Queen.
Betty, I've asked you not to call me that.
The only thing that's a little sus is that ever since he got here, he hasn't sat down.
Really?
For realsies.
Alright, well, let's go say hi to Mr. Smith.
And assess.
Mr. Smith, how are you feeling?
I'm doing okay. Would you like to sit down? No.
Is there a reason why?
I'm trying to get my blood sugar to go down.
Okay. I'm not following.
If I stay standing, all the sugar in my blood will rush to my feet, and when you check it again, it should be normal.
Well, that's not how blood sugar works.
But I heard you guys say you had to check my sugar every 2 hours.
That's correct.
And you said it has to be a standing order, so don't I have to be standing when you take it?
Sir, a standing order just means we don't have to get the doctor's approval every time we want to do it.
But also, that interpretation kinda eats. Is that why diabetics lose their feet first?
Mr. Smith, you don't have to keep standing.
No, I want to stay standing.
Fine, suit yourself. I'll be back in 2 hours to check your sugar.
And if you're hypo on us, we will give you a Snickers bar.
What?
You're not you when you're hungry. Keep up.
Betty, please go home. Did you hear the news?
What news?
Janice wasn't a real nurse.
What? That can't be true. She's worked here for months.
Well, I mean, there were signs.
Hey, have you ever given this med before? Metronolol? Metamanol?
Metoprolol?
Yes, that's the one. How fast do I give this?
Not fast at all. Over at least 2 minutes.
Oh, awesome, thanks. 2 minutes.
Maybe she never used it before. Different places use different drugs.
Well, what about?
Hey, stupid question.
There is no such thing. What's up?
What meds can I push through that arterial line again?
Never mind. That is a stupid question. The answer is none. Let's go check on your patient.
Oh, right, okay.
Okay, that's a little worse, but I still think our hospital would do its due diligence to make sure all our staff are properly credentialed.
Oh wow, there's already news on her. I didn't know Janice was from Florida.
Florida? Oh yeah, she's a fake.
This morning, a Florida woman is behind bars, accused of treating thousands of hospital patients without a license to do so. Police say 29-year-old Autumn Bardiza, seen here on body cam, was arrested in Palm Coast, Florida for posing as a licensed nurse for nearly 2 years. During that time, providing care to almost 4,500 patients.
What brought you into the ER today, ma'am?
You have to help me. I think I might have cancer.
Oh, why do you think you have cancer?
I found something growing on my butt.
All right, let's take a look. Oh my god, is that
Cancer?
chocolate?
Chocolate?
Oh, ma'am, it's a milk dud. You just sat on candy.
That's it? That's my cancer?
Yes, you're gonna be fine, but just check the floors next time, or the couch.
It was at a Love Island meet and greet.
Right, well make sure you check the meet and greet chairs before you take a seat then.
Got it.
Oh, I said 18 gauge, more like you need to increase my wage.
I have a question for you.
Oh, what's up, boss?
Can you remind me what your nursing license number is?
What?
Your nursing license number. The one we have in our system is wrong.
Oh, no, it definitely should be right.
That's odd, because according to the Florida Board of Nursing, your ID belongs to a woman.
I see. You know, I knew one day the truth would come out. You see, I was born
Your ID belongs to an Aliyah Adebayo.
a woman in Africa?
Right. So do you have any paperwork?
Duh. Yeah, I'm just kidding. You know, my license number is 1, 2, 3.
Your license number is 123. Do you even know how many numbers are in a Florida nursing license?
6, 7? Okay, look, I think we're focusing on the wrong thing here.
Which is
That for nearly 2 years, I have cared for more than 4,000 patients.
without a license to practice.
Perhaps, but as a nurse without a license, but with love. Any different than a nurse without love, but with a license?
Hi, can you send the cops up to 3 West? We have a criminal up here.
This is discrimination! This is discrimination!
He's in the hallway.
This morning, a Florida woman is behind bars, accused of treating thousands of hospital patients without a license to do so. Police say 29-year-old Autumn Bardiza, seen here on body cam, was arrested in Palm Coast, Florida for posing as a licensed nurse for nearly 2 years. During that time, providing care to almost 4,500 patients.
Hello, how can I help you? I need you to test this. What is that? It's my boyfriend's pubes on a towel. Ew! Oh my god! I almost touched that with my mouth! I need a paternity test to see if he's the father. We don't do that here. This is an ER. Well then, can't you send it somewhere? This is a hospital. No. I need to know if he's the father. Why wouldn't your boyfriend be the father? Because I'm sleeping with another man and I don't know who got me pregnant. Ma'am, like I said, this is an ER. We don't do... Are you really gonna deny a pregnant woman? No. Of course not. Let me just put this glove on, and I'll take that from you. Hey, Austin, catch! What is this? Some dude's pubes on a towel. Oh, gross! Rich! Okay, all done. Test determined, he is the father. But how? You didn't even get my DNA, or the baby's. Oh. Right. If you aren't gonna test it, I want that hair back, and I'll go to the hospital down the street. Well, I am not leaving until I get that hair back. Of course. Let me just put some gloves on. Operator. Austin, where'd you put that towel? I burned it, Rich. Go away. Ugh. Fine. Ah! Oh! Here you go, ma'am. I found it. Finally. Useless. I'll find out who the father is myself. Good luck with that. Next. Okay, sir, you're here for abdominal pain.
I was attacked and they shoved a bottle up my butt!
What? Who attacked you?
That darn masseuse! Oh,
Whoa, that is pretty high up there. Why did they attack you?
I was getting a massage and I didn't tip her, so she shoved a bottle up my butt.
Whoa, you didn't tip her?
How is that medically relevant to you right now?
Well, you should always tip your service workers.
Who gives a f, man? Take it out!
Hold on now, let's just think about this a minute.
Are you debating leaving it in?
No, that would violate my Hippocratic oath.
Your what?
I took an oath as a doctor to do no harm to my patients, although it never explicitly said anything about bad tippers.
I'm sure it was implied!
Alright. Although, maybe I'll just leave the tip in.
I see what you did there.
Okay, here we go.
Oh,
It's out.
thank you, doctor. And you know what? I've really learned my lesson. Here.
5%? That's it? No, don't do it. Remember your oath.
Good morning, Rich.
Merry Christmas, team. Where am I going? First of all, good morning, Mr. Scrooge. There's food in the break room.
Yes!
Thank Jesus Christ, I'm starving. But you can't eat yet because we're busy and I need you to take your assignments. What?
It's busy on Christmas?
Who the hell is coming into the ER on Christmas besides us? People with real emergencies who'd rather spend time with us than with their loving families.
I love spending time with you guys.
Can't relate. Except Bed 4. I have no idea what he's here for and he refuses to leave. Ben, if you can get him discharged, you can go eat. I'm on it.
When can I go eat?
Never. You're in triage. Bye-bye. Hi, sir. My name is Ben. What brings you in today?
I'm not feeling well. Can I have something to eat?
Not right now. Are you having any pain anywhere?
Yeah, my head kind of hurts. I have a stomach ache too, and my eyes kind of hurt.
Okay. Does any one hurt more than the other?
I don't know, man. I'm just not feeling well.
Sir, what exactly do you expect the ER to do here for you today?
I don't know. Isn't that your job to figure out?
Oh, for the love of... Seriously, isn't there anywhere else you'd rather be but the hospital right now?
Screw you, man.
Ben, we got a GSW in room 5.
What is happening today? It's Christmas, people!
What happened?
Gunshot wound, left leg, through and through.
I'm fine. I don't have to be here.
Sir, you absolutely need to be here. Unlike some patients.
Help me cut off his pants.
I said I'm fine. Leave it alone.
Sir, gunshot wounds are very easily infected. If we don't clean this properly, you could lose your leg.
I hope I do lose my leg so that every Christmas, my sister knows she shot my ass.
Your sister shot you?
And I'll shoot you again, motherfucker!
Oh my god.
What is happening in here? Security!
You better tell your husband you're cheating on him or I swear to God I will.
Who I sleep with is my business, and you stay out of it!
Let's all try to calm down.
Your husband is cheating on you too. You're both cheating on each other and I refuse to sit here and pretend like everything is okay.
You shut your lying little mouth! He would never cheat on me!
He would! And he is!
This can't be real. You guys ready for x-ray?
Yes. GSW is getting x-rays.
What happened?
Family drama. Can I have some food while I wait?
Sure. ER is almost empty.
Yes!
Oh, finally. Me too. Is bed 4 gone?
Oh, come on, I don't know what he's here for.
No food until you get him out.
Yo, baby, I know your feet must be tired because you've been running through my mind all day. Come here, girl.
Okay, sir, I have your discharge papers here.
But I'm not ready to go yet.
We've checked you. There's nothing we could do for you. You have to leave.
What was all that commotion about earlier?
Ugh. If I tell you, will you just sign the papers and go home?
Fine.
A patient found out his sister and her husband were both cheating on each other and he was gonna rat them out. So she shot him.
Wow. Talk about family drama.
Yeah, I guess they really cared about each other.
I wish my family cared enough to come shoot me.
Is there anyone we can call to come pick you up?
No, I don't have anyone.
Give me that.
You got him out?
Nope.
Hey!
Most places are closed on Christmas. It'll be hard to find food out there.
Wow, thanks.
Yeah, no problem. Take your time, no rush.
I still can't believe you shot me.
I said I'm sorry.
Does Mom know yet?
Yup, she's on her way in.
Oh, she's gonna kill us.
Wouldn't be the worst Christmas.
Yeah.
Ben, come eat.
Yeah, Ben, we got you another plate.
Coming. You gotta help me. I'm withdrawing real bad. I'm sweating, I'm nauseous, I'm seeing things, and look, I'm shaking. I see in your chart that you drink regularly. When's the last time you had alcohol? About a day ago. I'm trying to kick that nasty habit. Well, according to your assessment, your CWA score is between 16 and 20, which could indicate that you're in moderate alcohol withdrawal. Per our protocol, I'll get you some Librium pills. Librium? Pills? It's usually our first line of treatment. I think I might be having a seizure. I think I need Ativan. You know, tonic-clonic seizures are always accompanied by a loss of consciousness. I think I'm losing consciousness. Better get that Ativan. Aha. Can you get into bed for me first? Wouldn't want you to get hurt. I'll be right back. I think the seizure's getting worse. Is that Ativan? No, unfortunately, the doctor says if you're having a seizure, she's worried about respiratory arrest, so we're gonna intubate you. Intubate? Stick this tube down your throat. And then Ativan? Yeah, well, if shoving this tube down your throat doesn't work, then maybe, but probably not. Whoa! Wow. Did I just have a seizure? You tell me. How are you feeling? Much better. Wow, those withdrawals are real bad. Yeah, it's almost like you never had any symptoms at all. It's a miracle. Sure is. So just to be clear, I'm not getting Ativan? Definitely not. What, is that the time? I really gotta go? I figured. I brought the AMA paperwork so you could sign yourself out. You know, if you're really serious about quitting alcohol, I could give you some rehab info. Rehab? They never have the good stuff. I mean, no thanks.
Excuse me. Hey, excuse me.
Miss? I'm gonna have to ask you to be a little more patient.
I was promised to be discharged in 10 minutes, an hour ago.
Right, but we are a little busy out there, so if you could just be a little more patient with us.
No, I am a doctor. I work here. I know Dr. Chang.
Okay, look, miss.
Don't miss me. Just take out my Foley.
You know, if you would like to sign out against medical advice, I'd be happy to.
Against medical I am a doctor. I am medical advice.
Right, okay. I'll go get Dr. Chang for you.
Yes, please go do that. If I cut the Foley, the water from the balloon will just come out, right? Yes, that makes sense. Isn't the water supposed to come out? Oh! Ah! Oh, crap, crap, crap!
Dr. Chang, this patient says she knows you and wants to sign out AMA. Angela, how are you? I'm so sorry for the delay. We had 2 rapid responses and a code blue, but everyone's safe now, so let's get you out of here. First, I have to remove her Foley, so...
What? I think you may have dropped these.
Oh my God!
So, Dr. Chang, what's your medical advice?
Well, let's get a scan, call urology, and see what our options are for the next doctor because I'm off now. So, I'll see you Monday, Angela.
See you Monday, Dr. Chang. I think you and I might have gotten off on the wrong foot, Mr.
Don't. Just don't.
Welcome to the ER. How can I help you? My knees are killing me. Oh wow, they're really swollen. When did this happen? 4 days ago? It's starting to get hard to walk today. I'll get you a wheelchair. Any past medical history, surgeries, or allergies? Just diabetes. And I'm lactose intolerant, which is why I think this is happening. Why would that have anything to do with your knees? Well, I wanted my bones to grow stronger, and I've always wanted to be a little taller, you know? And? So I started using my insulin needles to inject low-fat milk into my knees. Low-fat milk? Why? You think I should have done whole-fat milk? No! No milk! Why would you put milk in your knees? Who told you to do that? It's supposed to be good for your bones. When you drink it, your knees are clearly infected. We have to drain them before you develop septic arthritis. No, don't drain them. The only reason this is happening is because I'm lactose intolerant. What do you expect us to do then? Just give me something for the lactose intolerance and leave the milk in there. Please. I have a date this weekend, and on my dating profile, I put that I was 2 inches taller than I really am. I'm hoping the milk kicks in by then.
Hey, your patient in room 613 has a headache.
What?
Your patient needs Tylenol. Call the resident. And good luck. I heard this one has a stick where the sun don't shine.
Oh.
Resident on call, what's your emergency?
Hey, this is 6 West. One of our patients has a headache and...
Did you call me at 1 a.m. for a headache?
Yes. I just need your okay to put in an order for Tylenol.
I think you mean acetaminophen.
They're the same thing.
Well, when I went to medical school, we learned to call medications by their generic names.
Yes, acetaminophen. Now, I'm just gonna put in...
Putting in orders is the doctor's job. What was the patient's blood pressure just now?
I don't know. The nurse just came in and said they had a headache.
Headaches can be a sign of hypertension, aka high blood pressure. If you didn't take the patient's blood pressure, this patient could be on the verge of a stroke.
Fine. I'll go get the blood pressure.
And what was their last LFTs?
Excuse me?
LFTs? Liver function tests? Acetaminophen is highly liver toxic, so without their LFTs...
Doctor, it is 1 in the morning. The patient just wants some Tylenol.
I'm sure the patient also wants to stay alive, which is clearly what I'm trying to do. I'll put an order for the medication as well as an order for stat labs. Do you get the blood pressure as well?
Thank you, doctor.
Resident on call, what's the emergency?
Hey, this is 6 West again. I'm calling because our patient from earlier with a headache doesn't have an okay to drink water order.
So you're saying...
I can't give any medications without water.
Are you calling me at 3 a.m. for...
In order? Yeah. After all, putting in orders is the doctor's job. Or are you no longer interested in keeping this patient alive?
Next time, just put in an order for Tylenol.
You mean acetaminophen? Got it. Thank you, doctor. Welcome to the team.
Hey, how much longer is this gonna be?
Unfortunately, sir, the wait time is still a little hard to predict.
So you still don't know?
I still don't know.
You see this?
Yes, that's your urine sample.
Yeah. What? Why would you do that? Why not if you're just gonna make me wait here and not use it? Sir, we need that sample for a test. Without it, all this waiting was for nothing. What? I guess I didn't think that through. I can see that. I guess I should go drink some more fluids then, huh? Well, why don't you just point me to the direction of the cafeteria? That way. Thank you.
That was weird, huh?
Oh no, that's just Mr. Jenkins. He does that all the time.
Huh.
Why isn't she waking up?
Sir, we need you to calm down and tell us exactly what happened.
Pinpoint pupils. She took something.
I brought Narcan.
I don't think this guy's gonna talk. We should just get him out.
She OD'd, man!
Okay, that's good to know. What did she take?
I don't know, man!
Vitals are stable. Oh, she's peeing herself. Let's get her into a gown.
Yep. Oh!
Was that ice?
Where did that come from?
Why is she dispensing ice from her crotch?
Sir, do you know anything about this?
Yeah, I tried putting ice into her, but it didn't work, man! Didn't work? What were you trying to do?
You don't know? What kind of nurse are you?
Sir, I've been a nurse for 7 years now, and never have I ever had to shove ice into a patient's crotch before.
Was I supposed to shove it somewhere else?
Can I kick this guy out now?
Sir, why did you put ice in your wife's crotch?
I was trying to get her cold to shock her awake!
Well, you definitely shocked me and the rest of the medical field.
Sir, you can't just shock someone awake by inserting ice into their crotch.
I told you! I told you it will work!
She's waking up from the Narcan.
Oh my goodness, I peed myself.
Don't worry, Mrs. Pearson. Dr. Pearson over here was able to use his medical expertise to potentially cause cold burns, irritation, small tears, or even introduce bacteria inside your crotch.
Leroy! They told you not to do this the last time.
Okay, guys, Mr. Peterson, from now on, do not shove ice into your wife's crotch, or anything else for that matter. No, I'm just gonna grab a mop.
Welcome to the ER, ma'am. How can I help you? It's my son. He developed a rash today. Well, it doesn't look like he's having any trouble breathing, so that's good. I'm just so worried. He's never had anything like this before. Does he have any allergies that you know of? No. Any new pets or animals that he's been around? No. Have you been using any new soaps? No. When did you notice the rash? Right around this morning, after breakfast. And what did he have for breakfast? Some blueberry waffles. 6 to be exact. Has he ever had blueberry waffles before? No, never. He might be allergic to blueberries. But that's not possible. His rash isn't blue. Right? Let's just get you guys back. We'll figure it out.
Congratulations on your new baby boy. Here's the birth certificate. Just put his name, your signature, and the date down below.
He's perfect. We're gonna name him Cass.
Oh, that's an adorable name.
Casanova. He's a ladies' man if I ever saw one.
Casanova? He's not a 16th century French nobleman. We're gonna name him after my hero, Donatello.
Oh, like the Italian sculptor?
No, the Teenage Mutant Ninja Turtle.
I told you, if we were gonna name him after a turtle, it was gonna be after Michelangelo.
Oh boy.
Michelangelo is lame!
Like father, like son.
Why don't I just leave the certificate here for you guys?
No, you're gonna help us settle this once and for all. Which name do you like then?
Okay, why don't we split the difference? Casanova, Donatello.
Are you trying to ruin my baby's life?
What the hell kind of name is that? Are you trying to get my son bullied before preschool?
Preschool? Our son will be homeschooled like a proper Casanova.
Nurse, hold the baby. My wife and I are gonna knuckle this out.
No, let's not knuckle this out in the hospital or anywhere else for that matter.
Wait a second. Knuckles.
You know what? Knuckles does have a beautiful ring to it.
Congratulations on your new baby boy. Knuckles, Casanova, Donatello, Lee. Hey, Mr. McDonald. Hope you're still doing okay. I have a new nurse here. This is Rena. Is it okay if she takes over your evaluation? Of course! How's it going, Rena? Hi. So, Mr. McDonald, as you know, you've been exposed to a potentially rabid cow. That's right. And you'll need the rabies vaccine to prevent infection. That's what they tell me. It'll be a series of injections depending on weight. Not a problem. 350 pounds. Oh no, I need your weight, not the cow's. 350 is my weight. Oh. Okay, thanks. We'll be right back.
Where is the OB? She just DM'd me. She's stuck in traffic. Okay, Miss Garcia, you need to push. Push!
Betty, you can't just say that to Miss Garcia. She doesn't speak English.
Oh my god. Miss Garcia, I am so sorry. I am so lo siento.
Wow, you're like fluent.
I am. She had a 4-day Duolingo streak last month. Yes, she did. We need someone who speaks Spanish. Okay, wait. When I was in Cancun, I was trying to open this door, and this really nice man said puta to me, because it was a push door.
Puta. Okay, that sounds like push.
It does.
Miss Garcia.
Puta. Puta, Miss Garcia. Puta. 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 Puta.
Breaking news. Maria Garcia, a new mother, is suing the hospital where she gave birth for racial discrimination after repeatedly being called in Spanish. The two nurses have been placed on temporary leave as the hospital investigates the situation. Is anyone gonna come send me on break?
Code blue, OR, room 3.
What the hell is going on? Steve, help, who is on the OR table?
It's Lexi.
Lexi who?
Nurse Lexi.
She was supposed to send me on break 20 minutes ago. Why is she unconscious? And why's your pants down?
We were having sex and things got escalated.
What does that mean? She asked for lube and I grabbed this jelly.
You grabbed lidocaine jelly? I didn't know it had lidocaine in it when I grabbed it.
You used an anesthetic as vaginal lube and anal lube. Oh my gosh.
She said she wanted to try something new.
Paralyzing her colon from the inside out is definitely something new.
Will you just make sure she's breathing? I can't feel my pee.
I'm supposed to be on break. Lexi, wake up. 26-year-old female found unresponsive after MD Kevin allegedly used lidocaine jelly during an unsanctioned sexual encounter in unused OR. Do you really have to use my name? How's your pee-pee? Still numb. Serves you right. Your wife is doing so well today, Gary. Her vitals are stable, no skin breakdown. I think this is the most peaceful I've ever seen her.
Oh, I think I know why.
Really? Why do you think? What is that?
That's mine.
Your what?
My hair.
A hair from where?
My belly.
Why is it on the rail?
When Maisie and I used to lay on the couch at night, she would always put her hand on my belly. I think it made her feel safe and at home.
So you
brought a piece of home here, and it's helping, isn't it, Maisie?
Sir, I don't think it is.
You said her vitals are stable today.
Yes, but
that means she could feel me. Gary's here, honey! Can you please make sure to lift her hand every few hours so she could touch my hair?
Oh, sir, I'm not touching that. Most families just bring in a picture, some flowers, or a favorite scent.
But this is a good idea too, right?
Well, you can't argue with the results. She is stable.
তোমাদেরকে আমার পরিচয় মানুষ চিনে তোমাকে চেনে ইউ আর দ্য ফাদার অফ ম্যাক্স দ্য প্র্যাঙ্কস্টার ঠিক আছে তোমাকেও মা
বিরাট স্টার
বাট আমি চাইবো আমার ফার্স্ট মিটিংটা অনেক গ্লোরিয়াস হোক আর যদি সে ফ্রড হয় তাহলে কিন্তু ওর খবরই আছে একদম থাপড়ায় সব দাঁত ফেলে দিব যাই হোক দেখা যাক কি হয় আমার লেট হচ্ছে দোস্ত রাখি হ্যাঁ
টিন্ডার থেকে তুমি এর আগে আর কারোর সাথে কফি ডেট করেছো আমি ছাড়া
হোয়াট আমাকে কি দেখে মনে হয় চিপ আমি এক্সক্লুসিভ ভার্সন ওকে আই এম নট अवेलेबल কি ছিল
প্র্যাঙ্ক ছিল বিশেষ হচ্ছে না এই যে আই সুইট ওই যে দেখেন মনোপড নিয়ে দাঁড়ায় আছে এই যে আরেকজন ইফতে একদম গুলি করে দিব মাথার মধ্যে ফুটা করে একদম এদিক দিয়ে বাইর করে ফেলবো কি আছে বাইর কর
কিচ্ছু নেই
দে হাত কি লুকালি দে
হ্যাঁ দোস্ত ওই যে প্র্যাঙ্ক বাজ ওই যে কি জানি একটা ছেলে আছে না ফালতু সারাক্ষণ মানুষকে ধোকা দিয়ে বেড়ায় ওকে চিনিস তুই
হ্যাঁ চিনবো না কেন ওকে না চিনার কি আছে ওকে চিনে না এমন কেউ আছে
এই শিখেছি ধরে 50 কি টেলিলেন্স নাকি হ্যাঁ 85 ইউজ করবি দরকার পড়লে তোর আমি 70 200 কিনা দিব
তুই টেনশন করিস না হ্যাঁ
কোনো চোর না চুরি না ডাকাতি না এটা প্র্যাঙ্ক ছিল টোটালি প্র্যাঙ্ক শিখাইছে উস্তাদ কেমন হলো প্র্যাঙ্ক এটা সত্যি প্র্যাঙ্ক ছিল আমি ক্ষমা চাচ্ছি সত্যি প্র্যাঙ্ক ছিল এ ভাই দেখেন কালোই তো করবো আরে আপনি তো এমনিতেই সুন্দর
বাবাকে সালাম কর, আরেকবার সালাম কর। মা, আমার বিয়ে করা বউ, তোমাদের বৌমা।
আমি আসছি তো। আমি সব ঠিক করে ফেলবো, তুমি বসো। বসো তো, এখানে বসো, আমি দেখছি। আন্টি, আঙ্কেল,
মনে নেই একবার টাকা দেওয়া নিয়ে কি নাটকটা করলি?
আচ্ছা ঠিক আছে, আমাকে বল টাকা দিয়ে কি করবি, আমি দিব।
বাবা মেয়ে মিলে আমার থেকে কি লুকাচ্ছ তোমরা? হুম, দেখো আমাকে।
এখন মনে হয় 30 টাকার মতো আছে, নিবি? 30 টাকা দিয়ে কি হবে?
কয়েকদিন ধরে দেখতেছি তোর পড়াশোনায় একদম মন নাই। দাঁড়া, তোর আব্বারে বলতেছি।
যাও যে এখন
আমার মনে হয় আমি জানি স্পেশাল মানুষটা কে। আরে রূপা না, আছে অন্য কেউ।
তোমাকে কিন্তু আমার অনেক ভাল লাগে আপু, কিন্তু তোমার ভাইটা না কেমন জানি। তোমরা দুই ভাই বোন, নিজের ভাই বোন, কিন্তু দুজনের না কোনো মিলই নাই। কই সবাই তো বলে মিল আছে। দাদা বাড়িতে ঈদ না করলে মজা হয় বলেন?
এখানে অনেক মজা হবে।
দাদা বাড়িতে
ভাই আপনি নিয়ে আসেন, আমি আপনার 500 টাকায় দিব, ঠিক আছে? ঠিক আছে তো? হ্যাঁ ঠিক আছে, তাহলে নিয়ে আসবো না কিন্তু। ঠিক আছে ভাই।
তুমি দুনিয়ার কিনা, তাই তো আমার সন্দেহ। মনে হচ্ছে বেস্ত থেকে হুড় করে নেমে আসছে।
কিন্তু হাসতেছো কেন?
না, আমি আর্জেন্টিনা, আর আর্জেন্টিনা এবার বিশ্বকাপ নেবে।
কি কথা বলবি?
এমনি ফ্রেন্ডশিপ করবো। তোর কাটা কেমন? ভালো। টাইপ নিবি?
কারের দোকান আসছে তো কাঠ কেনার জন্য।
মা, মোম দিয়ে যাও না।
আরে আসতেছি রে বাবা। আপনি ব্রাজিলের সাপোর্টার, আর ব্রাজিলের সাপোর্টাররা কেমন হয় এটা আমি জানি না। ওরা কখন আর্জেন্টিনার ভালো
হাই হাই খাইছে করছোটা কি তুমি?
তুমি একটা ভিডিও কল করে পাঠাও প্লিজ, প্লিজ। কবে আমগো দেখা
কোচিনটা কি এটা আবার লগে এমন চিপা মাইটা দিয়েছেন? কেমন খানদান বউ? তারপর তো ভয় কাচে মুচু খায়া গেছে গা, তারপর আবার দুর্নাম করতে হইব। এই তোর কি তোর দামি ফোন আইছে বাবজান?
রাইতে ঠিকঠাক মতো ঘুমাইছে তো নাকি বাসায় গিয়া আব্বাজান রে কইবেন?
কি করছো এটা তুই? বাজার রে বাজার যাও চুইছে আজকাই করছে,
সম্মান সব পাঞ্চার করে দিছে।
মাগার দোষ আমারও আছে, আমি একটু বেশি বাড়াবাড়ি করে ফেলছি। চলো না আমরা বাড়িতে ফিরে যাই।
তুমি কি পাগল হয়ে গেছো নি? এটাই আমার বাড়ি এখনতে।
চৌধুরী সাহেবের সাথে আমি কি কথা কইছি? তুমি কোনো কথাই কই নাই কে? সাজান তোমারে কইলো এত
দিচ্ছেন, হ্যাঁ দিচ্ছেন না? এলা বাইরন, আমার বাড়িতে বাইরন।
একটা হাসা করছেন আব্বাজান, আপনার পোলার এই বাড়ি থাকার কোনো বিতলামি করলে আমি তোরা ঘাড়াই, কিন্তু ভাবলাম আপনি তো একমাত্র পোলা, ঘাড়াইলে আবার দিলে চোট পাই।
দিতাছো তুমি?
শোনো, তোমাগো খানদানে যেমন কিছু নিয়ম আছে, আমাগো খানদানেও আছে।
এইসব ফাত্রা নিয়ম কেউ যেন জানবার না পারে, মনে থাকবো তো? তোর যে নতুন বাবি